Well, good day, everyone. I am Amy Rasmussen, President of IAAO, and I'm pleased to be joining you today and would like to thank ESRI for putting together this discussion on how GIS tools can be utilized during times of crisis and distress. ESRI, as you may know, has long been a sponsor and conference exhibitor for IAAO functions, but just as importantly, they've been a longtime partner and friend to IAAO. IAAO even had the distinct pleasure of having their founder and president, Jack Dangermond, as our keynote speaker at our 2018 conference in Minnesota. And we were extremely happy that Jack was with us. I would also like to thank all of our presenters for taking their time to share with us today and showing us how we can use GIS tools to our advantage, making the most out of their robust capabilities. You know, as assessors, we have data that's very important, not only to us, but to organizations outside of our offices. And I think that we need to all embrace a philosophy that the data that we have, data that's actually collected by government employees, is not our own data, but it belongs to everyone. We don't hold it solely for our use. It's really for the greater good. The data that we have is authoritative, and it can help frontline decision makers make better informed decisions by having the best well-informed data that they can as possible. This data becomes incredibly valuable when it's used with GIS. Our data, when it's used with the GIS, can illuminate many capabilities of the platforms and geospatial infrastructure. I find it exciting that so many assessors use GIS in their evaluation workflow. I know that not everyone is there yet. And so for those of you that don't, IAAO does partner with the Urban and Regional Information Systems Association, what we usually refer to as URISA, for the GIS Valuation Technologies Conference every spring. Now, unfortunately, it was canceled in March this year due to the COVID crisis, but we're going to work with URISA to deliver this content online over the coming months, so please be watching for that information and that announcement. IAAO is committed to delivering information to members and on all aspects of valuation, including utilizing GIS. Hopefully, you're aware that IAAO published a GIS book for property tax assessment professionals in 2018. The really cool thing about this book is written by people who work in the assessment world for assessors and their staff, and I would highly recommend it. It's a great book if you're just getting started or if you want to increase your use of GIS. We all know and we have seen that the coronavirus is a global pandemic and it's affecting people in every corner of our world. But in reality, disasters are local. They affect our communities, they affect our friends, and they affect our neighbors. You know, when it started in December in China, it may have seemed from where you're located, that was a faraway place. But now in the United States, every state has been affected, and almost every county in every state is starting to become affected, which means that if it hasn't gotten to you yet, it likely will. You probably know someone that has gotten it. As you're going to hear today, there's a lot going on leveraging GIS to help with the response on a global, on a national, a state, and even drilling it down to a county and a city level. You'll also hear about ways to use your CAMA data, primarily property characteristics combined with population data, to assist in the local response to this coronavirus. I'm glad that you're joining us and listening in today. IAAO values all of our members, and we believe that communication is the key to successful relationships, and we're happy to be partnering with ESRI to communicate this information to you. So again, I want to sincerely thank ESRI for their commitment to IAAO and the time that they have put into developing this webinar, this timely webinar for property valuers around the globe. No matter what the title we have, our jobs are all fundamentally the same, and it's nice, I think, that we can come together and learn from GIS leaders in the industry how we can do these jobs even better. So at this time, I would like to turn the webinar over to my friend and my colleague, Brett Jones, who's the Global Manager of the Cadastre and Land Records with ESRI. So he'll get us started and introduce our first speaker. Mr. Jones, you want to take it away?
All right, thanks, Amy, and thanks everyone for attending. We've got a lot to cover here, so I'm going to be brief with the introductions, but it's important to know that we have a deep bench on this webinar. Dr. Geraghty is the Chief Medical Officer and Health Solutions Director here at Esri, where she leads all the business development and health and human services sector. Este is the former Deputy Director of the Center of Health Statistics and Informatics at the California Department of Public Health, an Associate Professor of Clinical Internal Medicine at UC Davis, where she did quite a bit of research on geography and public policy. She may be the only MD who is also a GIS professional at GISP, so we're happy to have her today. Also presenting following Este is Kim Christman. She studied geography at University of Wisconsin-Milwaukee and has been working in real property since 2001. She's a current board member and past president of the Wisconsin Real Property Lister Association. She's implemented a COVID hub for Racine County, and she's got a lot of good understanding of local needs. And assisting Kim is Kyle Wikstrom, a solution architect at Pro-West Associates in Minnesota, where he works mostly with state and local governments to solve everyday problems and modernize their approach using location technology and GIS. And Pro-West is a strategic partner of Esri. And last and certainly not least will be Kevin Ruggiero. Kevin is a solution engineer here at Esri in our Philadelphia office. He's a super sharp guy and a personal friend of mine working in land records. He's been doing this for over 35 years and is key in pioneering the use of CAMA data and GIS for COVID response. We'll have an additional meeting on Friday to drill down into the how-tos and get very technical on this, and I anticipate we're going to have several more. Because we have so much material to cover, we'll have a meetup on policy maps and how they're helping with COVID, and try not to squeeze it in and rush it into this webinar. What we hope you get out of this webinar is an understanding of how GIS is being used to understand the spread of the coronavirus, the tools, data, analysis, and of course maps that are being used. We'll then highlight Racine County and how they're doing their part at the local level, at the county level, and then dig into the technology a little so you can see how you can use your assessment data with response planning. During the webinar, if you have any questions, please enter them in the GoToWebinar question pane, and I'll be pasting links of what's being presented during the presentation. I might not be able to keep up, but we'll make sure we get all the links out to you following the webinar. And we'll follow up with an email and a recording of this as well that you can share if you want to go back over it yourself as well. So again, thanks for your time today, and over to you, Este.
Thanks, Brent. And can I double check that you can see my screen?
I can see your screen and you sound great.
Great. Thank you very much. And good day, everyone. I think this is my first time ever speaking to a group of assessors, so I'm actually pretty excited about bringing health and assessors together and having this opportunity to share with you about the GIS tools, templates, and free resources that we have for COVID-19. To advance these. There we go. All right, well, coronavirus or COVID-19 is, as you know, creating massive public health and actually broad governmental challenges for jurisdictions and communities across the globe. And those challenges include things like coordinating the data resources, the maps and information products across all the different relevant departments, not to mention that there's a strong need to share information with the public. And today I'd like you to think of a GIS as an enterprise system for pandemic response. And it's actually being used broadly from health responders like the World Health Organization to university researchers to even certainly disaster agencies like FEMA and the US military. And hundreds, if not thousands, of local governments like St. Johns County, Florida, are taking advantage of the tools so that they can support their own populations in a holistic way. Now, it's probably unlikely, but in case there's anyone on this webinar who's not familiar with GIS or thinks that a GIS is just a map, I will just say once that I want to assure you that a GIS is a comprehensive and integrated system for all kinds of critical workflows, including the one that we're going to focus on today, which is understanding and responding to pandemics. So in this case, you're certainly going to need a GIS support team that is going to be able to facilitate all of the key mission areas like disease surveillance, planning, logistics and field operations, making sure executives are aware of what's going on and are able to manage appropriately, and of course, community engagement. Now, GIS provides a framework and a process, and that framework and process is used for almost every kind of application that people need to perform. I think of this as kind of like a workflow. Now, we know it all begins with data and measurement, and then we want to take that and visualize it and analyze it for a deeper level of understanding, which helps us get to the stages of planning, decision-making, and action. Now, in the unique case of COVID-19, these are some more specific information products and data sets that can be used in this workflow kind of model. So we want to measure things like healthcare facilities, cases, demographic information, and our vulnerable populations. And we communicate with strong mapping and dashboards to visualize this stuff. When we get to the analytics, what we're looking at here are things like forecasting and understanding the impacts in our local area. We do intervention planning. That would be things like social distancing to stop the spread of the virus. And then we do testing and treatment, focusing on site selection for choosing the right locations for these kinds of resources. And I think many of you know, I mean, this is old hat for GIS people. And a GIS also helps people allocate where we are going to put equipment or personnel or other kinds of needs based on those forecasted models. Finally, it is a collection of tools that help us to engage communities, and it is absolutely data-driven and science-based. Now, specific to COVID-19, we have some predictive tools like Penn Medicine's CHIME model. Maybe you've read about this one. So this prediction model uses case information for COVID-19, social distancing parameters, and hospital bed information to be able to predict when and where local hospitals will reach and potentially exceed their bed capacity. As you can imagine, I mean, this is extremely important for how you're going to plan your resources. We can also then look for patterns or clusters of disease, or maybe even clusters of populations that are more vulnerable to severe disease. And like I alluded to before, we have tools for site selection and resource allocation to assist in those difficult decisions that governments and healthcare organizations are having to make. Now, this slide is meant to show one of those workflows and how several spatially varying measures come together to help us understand first the case distribution and population vulnerabilities. And then you put that together and see how that information feeds into your local capacity calculations. And that has to be paired with data from hospital-based resources, like how many beds do they have in the hospital? How many of those are ICU beds? Do they have enough ventilators? When everything is said and done, that's when we can use all of these inputs to make faster and better decisions about how we're going to either use, augment, or adjust our resourcing. So, where do you start? Well, I've developed this 5-step framework for understanding the impacts of COVID-19. And I would say that just about anything that you would want to do with GIS for this pandemic can fit into one of these areas. So briefly, they are map the cases, map the spread, identify and understand the vulnerable populations, map the capacity of your system to be able to respond, and communicate with maps. So let's look at how some different organizations are operationalizing these steps. Now, when I say things like map the cases, I'm talking about the confirmed cases, the active cases, fatalities, and recovered cases, to get that overview that you're going to need to understand the current situation. Now, for the data, you may have your very own local information that is the best and most granular data possible, and I certainly hope that that's true. But if not, you could use the Johns Hopkins University county level data that's available on Esri's COVID-19 GIS Hub. What I'm showing here is Fauquier County, Virginia's COVID-19 case dashboard. Now, they've actually pulled in all of the cases for the state to give a sense of context to what's going on around them. And then when you zoom in, you can see Fauquier County itself. And at the point when I took this screenshot, it's probably been about a week, there were some nearby cases to the east. And I'm pretty sure that the county authorities were keeping a close eye on those cases to see if it would spread in their direction. So after you've developed that step 1, the situational awareness, step 2 is mapping the spread of disease. Now, epidemiologists often will look at the number of cases per day to see the outbreak's distribution over time. So what I'm suggesting when I say map the spread takes that idea to the next level, and it adds the geographic spread as well. So I would say that when you know the direction of spread of disease and the pace of that disease spread, that's when you can start to determine when and where you're going to target interventions like shelter-in-place instructions. The example that you're seeing on screen comes from the University of Virginia's Biocomplexity Institute, and across the top they've got a very nice day-to-day time slider, and then on the left you can see the number of new cases per day. And then in the mapped area, of course, it brings it all together so you can see the mapped cases over time. Now, step 3 in the process is about mapping vulnerable or higher risk populations. So when you think about it, some people are going to be at higher risk of severe disease, like older adults and people with chronic medical problems, or we call them comorbidities. Some might be at higher risk for actually transmitting disease, maybe people who live in high density populations. So these and other relevant factors tend to be distributed differently across our communities. So here's some examples of step 3 from Kansas City, Missouri. And the first map is showing where we have high numbers and high percentages of senior citizens across the community. And here we're looking at the population density, and the lighter colors that you're seeing are higher density areas, and that might indicate more likely interactions among residents. And I don't know if you guys are aware that the CDC provides a social vulnerability index that they make available on Esri's Living Atlas, so that you can look at 15 different measures of social vulnerability and find the areas of highest concern, like in the dark blue color. And in this last map, we can see in red the areas where you have a greater proportion of the population that is lacking health insurance. So no matter what variables you put in there, once you understand your community's vulnerabilities, you're going to want to determine your capacity to respond. So here's a very first basic step. In this case, we're looking at New York City, which of course has been in the news quite a lot lately. And across the top, we're just showing some vital information related to the population, how many households, median income, median age, that kind of thing. The next section that you're seeing is based on the CDC's current predictions for infection rates. You're seeing that in the upper right. We're assuming a 20% infection rate in this model. And then the hospitalization rates, intensive care unit needs, and fatality rates. And the CDC is providing this by age cohort or age group. And so they give a low range estimate and a high range estimate. So all we did was carry through the math for the local population characteristics and their age breakdowns. So I would say that this kind of information offers some initial insight into a jurisdiction's overall capacity needs that they'll have for the duration of the event. Now, in this example of mapping capacity, we're seeing Jefferson County, Tennessee, and their hospital bed capacity information. So you can see the county boundary, and the hospital is a little teeny tiny dot, so I put a circle around it so you would see it. And what we can see is that this hospital has 58 staffed beds. That, frankly, is not a lot. So if Jefferson County were to start seeing a lot more cases, they would really want to do things like look at their neighbors to handle the overflow. In this case, the University of Tennessee Medical Center has 609 beds in their system. Now, we can get even more detailed than and we've provided geoprocessing tools that help calculate the when and the where of the curve for COVID-19 in terms of hospital capacity, and all of that information is on the COVID Hub. The fifth basic step that I wanted to share is communicating with maps. Now, many of you, probably most of you, are already doing this. Valley County, Idaho, and Leon County, Florida, are both doing this, thinking about businesses, how those organizations are impacted and how they've adjusted their business models to be more resilient in this difficult time. Many jurisdictions are providing public information about things like school closings and event cancellations. Now, at some point, if you think these are irrelevant now, recognize that these kinds of applications will be showing the opposite information as we move toward recovery, like which schools have been reopened and which events are now rescheduled. In the lower right-hand corner, you can see that Boone County, Missouri has used county impact planning reports that we've created to gain insight into what's going on with their community characteristics and how that helps them plan for their response. Now, the state of Alabama has implemented a testing site locator so people can find their nearest testing center. And early on in this crisis, actually, the state of Oklahoma shared nationwide airport impacts to bring awareness to travelers from across the country. So now that you have a deeper understanding of the 5 steps, the question is always, how can you take action? And so you start by implementing the COVID-19 information model, and I'm going to show that to you next. Then you begin your community risk analysis. You'll look at the social distancing data to see if it's actually flattening the curve in your jurisdiction. Or maybe you're going to need stronger interventions or different messaging to make sure people are really hearing what is being advised. You're then going to keep an eye on the daily spread of disease as you run things like your forecasting models for the hospital bed capacity. Then, as needed, you'll cite locations for new resources, like where should you put testing centers or alternate treatment locations. All of this begins with the information model. Excuse me. I've been talking a lot for the last 8 weeks. This information model that I'm about to show you is really based on the interactions that we've had with our customers over the last 8 to 10 weeks. And so we've determined the data sets that we think are going to be most useful to those responding. So starting with demographic data, you want to collect that socioeconomic information. Age is obviously important. Some racial groups are at a disparity when it comes to COVID-19 in certain locations. You want to figure out if you have pockets of people with higher levels of medical comorbidities, where your vulnerable populations are in general, and your high density housing and population numbers. Then you want to be able to look at the cases. Where are the confirmed cases? Who's in the hospital and the ICU? And I don't mean who, I mean how many. Thinking about anonymized and private data, we want to know how many are recovered, how long that took, and the deaths. You also want to be able to keep track of the people who've been tested. How many have been confirmed positive, confirmed negative, or maybe are still unknowns. And there's a lot of information we want to collect from hospitals. So you need to be able to define a hospital service or catchment area. And then you want to look at overall capacity in a couple of different ways. How many beds are there in the general hospital beds or the ICU beds? What's their current occupancy? And how many ventilators are available versus in use? Now, while this isn't a data set so much as it is forecasted data, it's still important to remember that we can use models. There are several of them, not just the CHIME model that we put into our tool set, to show when you'll find the date and duration of the peak number of regular beds, ICU beds, and ventilators that will be needed and used in any particular community or any particular hospital. You want to look at the directives that have come out by different community levels for social distancing. You know, are you at the level of event cancellation and school closures, or have you limited non-essential travel in your jurisdiction? Are you in a shelter-in-place requirement, or even going so far as a full quarantine? Making note of those is very helpful, as is then your ability to overlay on that mobility data. So this is taking cell phone information from a portion of the population, anonymizing it and aggregating it so that you can see the change in movement from pre-COVID days. And you can start to determine if social distancing is taking hold and if it's being effectively used in different communities. In other words, is it flattening the curve? You can look at average distance traveled. You would expect that that's going to be shorter in local neighborhoods where people are only going out for essential goods and services and spending an increased amount of their time at home. And then you want to think about if you have to site additional facilities to take care of the load, whether that's alternate care sites or testing sites, what kinds of places would be useful? It may be decommissioned hospitals or prisons, for example, that can be sectioned off for private care rooms. You might look at university dormitories, hotels and motels, fairgrounds, ships have been used. For testing sites, you may also want to consider sporting arenas, large public parking lots that have good and secure ingress and egress for drive-through testing or walk-up testing. Lots of options here, and in order to be able to do location allocation kinds of testing, you need to have some candidate locations to support that. So now I wanted to say that given that I've already presented a lot of information to you, I know that there's so much to do, and we as a company recognize that people have technical and time constraints and they need a quicker and easier solution. So we can help with that. So just briefly, we've created 2 solutions that you can download and use right away. The first one is for COVID-19 response. So at the community level, being able to track the cases, the status of schools and public gathering places, and provide that information to the population is really the focus of this first solution. And we also have a business continuity solution, which is meant to help businesses stay in better touch with their employees and manage their needs while they're working virtually, to also manage their facilities and their public communication to their customers. Now, to make the information usable and accessible for everyone, we know people need a single place where they can get that authoritative information, and that is our COVID Response Hub. And we've even built a template so that you can use it. Now, both of these solutions come with software and support services, which include everything that you're going to need to deploy and use them quickly. And to help you, we actually have a number of resources. You may want to take a screenshot of this, but we have instructions on how to deploy the hub with only a few clicks. We have inspiration, other jurisdictions that have created their own hubs. You can take a look at those. And then we've got detailed instructions and videos to actually walk through deploying the solutions. But most importantly, everything that I've discussed today can be found right here in the Esri COVID-19 GIS Hub. This is a one-stop shop for data, resources, maps, tools, and guidance. So please take a look, and we're updating it every single day, so check back. And that hub does include additional important information. I just want to bring your attention to this about how to de-identify protected health information. So I'm really just giving you this slide to put a bug in your ear so you remember to look in the resources section of the hub under best practices and see this tool, for example, provided by our business partner GIS Inc. It's called MapMask, and it will help you geomask and aggregate with statistics to let you know if you're properly de-identifying protected information. They're offering it for free for 6 months, so please go and take a look at that. And so finally, as you think about using GIS to address the COVID-19 pandemic, know that the technology is here for you to use. It works very, very well, but this requires more than technology. You need a strong champion and great leadership involvement to make things happen. Your mission is going to drive your strategy. And I just want to say that you really need to have clear, focused questions of what you're asking of technology and making sure that it's focused on the most important issues. Internal governance processes are critical at this time for how you share data internally, how you share with your partners and with the public. And of course, there is a very important key role for GIS professionals to make this whole system hum. And with that very fast overview, I covered a lot. I'm going to hand it back to Brent to carry on with the webinar.
All right, thanks a lot, Este. There's a couple questions in the window while Kyle and Kim get set up. You might want to take a look at about the some of the indices and some of the bed demand and respirator demand across, say, county boundaries. All right, now we're going to see a hub in action at the local level for Racine County. Are you ready, Kyle?
Yes, while I get my screen ready. One here.
All right, I guess I'll take it away. Hi, everyone. My name is Kim Christman, and I'm the real property lister and GIS manager for Racine County, Wisconsin. That's located in the southeast part of the state between Milwaukee and Chicago. I'm here to share my story with you about dealing with the COVID-19 pandemic. First, I'd like to share a little backstory. In the summer of 2017, I and some of my colleagues were at the Esri user conference in San Diego when a disaster struck southeast Wisconsin and northern Illinois. It rained for a few weeks, pretty much nonstop, and our rivers started to overflow and our infrastructure couldn't handle that amount of water. So sitting in California, I felt powerless to help. And at the time, the Emergency Operations Center didn't really think about GIS as a resource. With conversations in San Diego at the UC, we referred to the Esri's disaster response program. They had a pretty large floor presence at the exhibitor hall, so we went there and started to explain what we knew at the time, and they moved quickly. They set us up with 50 extra ArcGIS Online licenses, a Survey 123 damage assessment, which was geared towards 2 separate communities, an incident command briefing, story map, public information map, a weather data, state images of the flood, and a slider map to show change, and also a map showing the damage assessment surveys as they were uploaded, along with the 211 calls from the public that reported the damage. This allowed management or incident command to make sure all the calls were being verified. And this helps when you're in a government situation, eventually applying for assistance to quantify all the damage in a value, basically. Normally, this would have been done through phone calls and emails, but I was lucky enough to be in the same room with these amazing people. All of this was stood up in hours and sent off to Wisconsin for the boots on the ground to use. But then trying to get buy-in was our next obstacle. No one wants to learn anything new during an emergency. So when we got back to Wisconsin a day later, it turned into a campaign to get buy-in, and it actually worked. A few days later, we were training volunteers with donated smart devices to do damage assessments. Now fast forward to 2020 and the COVID-19 pandemic. My powers that be reached out to me asking what I could do to help with preparing, planning, and recovering from the pandemic. At almost the same time, Pro-West reached out to me asking if they could help with setting up the coronavirus hub solution from Esri. It was perfect timing, and with our long history, Pro-West is a perfect fit. They moved us to the enterprise, they stood up our ArcGIS Online account, and worked on different custom applications over the years. They know our system and data like it's their own. Now, what data did we want to see? How much was going to be public facing? what kind of information could we get, how often would it be updated, and who was going to maintain it. The questions kept coming with no clear answer. So in the beginning, the concept was to get it started, show it to the decision makers for approval. And at first, the county was going to set up their own information page. They just wanted me to work on maps. They had never seen a hub and they didn't understand what we were going to be showing them. So as you can imagine, they changed their mind when they saw the hub stood up. They wanted to show a place to get local updates, messages from our local leaders, information on where we could get food, like what's open, what has reduced hours, what other services they're offering, like delivery, pickup, and curbside. And then also information on closures of public buildings. Then as we started using the hub, I was asked to add other local resources, like, for example, we have the United Way of Racine County, Veterans Crisis Line, the 211 resources, healthcare providers, and then social media links to the CDC, our county Twitter and Facebook, and then our 2 local health departments. Insert mind-blowing emoji to the decision makers. They loved the page. Now, to get the data into the case, about the cases, we currently rely on our state's Department of Health Services data. So if you look at our dashboard, you can see it was set up to show southeastern Wisconsin and not just Racine County. The reason I wanted that was because the county border doesn't really work in real life. People connected outside, the people have lives that don't follow that invisible line of the county border. It's more realistic that we think about people moving fluidly around a region. Then as things have progressed, the idea of collecting donations of face masks and other PPEs moved to the front of the list. So we created a map to show citizens where they could drop these items off. Then the next thing was creating, up until yesterday, early voting or absentee locations, because our local municipalities started to change their procedures due to the pandemic. So some offered curbside vote in person for early voting. Some had restrictions on the number of people they would allow in the building. Some didn't allow you in the building anymore and only had you drop things off in their box at the front of the building or through the post office. These types of things were new and directly related to the pandemic. So it's a fluid solution as the focus is ever changing. Someday it's all about the map and other days it's about public mental health. We also have an internal application set up for our Emergency Operations Center, or EOC, to help for planning for shelters and overflow needs. And it's ever changing. As you saw in the part of the presentation before, there's so much to this that we're just trying to get as much information out as we can. And with that, I will pass this off to Kyle.
Okay, thanks, Kim. All right, so a part of our relationship with Racine goes back approximately 5 years when we were connected with the county and worked with them to help them modernize their land records and their GIS implementations. And with our longstanding business partnership history with Esri, we were able to help bring together a collaboration of people who could help the county implement the technology, not just the technology, but the technology that met the county rate where it was at with the solutions that they needed. So when the question of a COVID-19 hub came around, we had reached out to Kim and her colleagues to ask what sort of solutions is the county being challenged with? What are the local needs that we can help to stand up these Esri solutions that they have created templates and solutions for? And some of the primary challenges included that there was information coming in from multiple unverified sources, that there was information that needed to be shared by multiple different actors in the situation. There was the need for information about what resources were available at the local level and how to share that information, as well as having a way for staff to easily aggregate this resource information and verify that. So using Esri's COVID-19 hub, we were able to very quickly stand up a centralized location for anyone in the community, whether that be staff or citizens or emergency management personnel. We were able to set up this page for them to go access the resources that were being compiled by these different agencies and these different staff members and individuals. And then by standing up the coronavirus response solution from Esri, which is a series of maps and applications designed to help meet specific needs, we're able to deploy a suite of maps and applications, and then with some additional configurations, all available out of the box, we were able to configure those maps and apps to meet very local, very specific needs that were had at Racine County. And what I'm showing a screenshot here is of the COVID-19 hub as shared by Esri that has been set up specifically for Racine County, where they wanted to share latest update information, as well as share information that has been contributed from other collaborators, such as county executives and law enforcement and emergency management personnel. You can also see in the screenshot under local resources the different types of maps and apps that are being used to answer the questions that people within the community are asking. There was also the need to understand the situation around Racine County, which is where information provided by the Wisconsin Department of Health Services became invaluable. We were able to leverage that data source and create a couple mapping applications that showed not just the situation within the county, but also without in those nearby locations. So again, using the coronavirus response solution, we were able to add in some configurations that made those solutions specific to Racine County's needs. In this case, what we see here is a food supply resource locator, which is designed to help anyone in the community locate the different food services that are available, whether that be restaurants providing curbside and takeout services, or grocery stores that perhaps maybe have reduced or altered hours. We also mentioned the need for this information to be provided to the county in one streamlined way. So we set up a Survey 123 application to crowdsource these reports from anyone in the general public. And the Survey 123 application can be used to report your facility location, your address, the different types of services that are available at your location, as well as a set of contact information. And then what staff have at the county is an internal mapping application that allow them to receive and respond to these crowdsourced reports. So that way county staff have complete control over what information gets displayed on their authoritative map. And in a similar fashion, we had helped configure this closures application that shows the locations of public facilities as well as others, and solicit information from the general public who maybe choose to report the status of their operations. And more recently, with the need for more personal protective equipment, more PPE, there's been the call to action from the general public to, as able and willing, provide donations of PPE, whether it may be masks or face shields and things like of that nature. And with a similar application, we were able to help the county stand up an application that showed the locations at which donations were being accepted, but also by selecting one of those locations, the user can get instructions on what type of PPE is being requested and perhaps how to create that. So that is a very high-level overview of some of the solutions that we helped Racine County stand up very quickly using some of the out-of-the-box solutions that Esri has provided. And both of those, all of these solutions you can find by going to Racine County's website. And at the top center of their county webpage, there is a link that anyone can go and explore that hub and those applications that have been set up. So with that, that ends my my overview. And Brent, I will turn it back to you.
All right, thanks a lot, Kyle. That was well done. As Amy said in her introduction, your assessment data is very valuable and useful in GIS. In this case, combined with social and demographic data, your data delivers valuable understanding to those planning responses to the coronavirus. Maybe you noticed in Este's presentation the neighborhood map of morbidity in New York City. That neighborhood level information is quite valuable. So we've all seen the Johns Hopkins dashboard at the global level. You may not have seen some of this analysis going on behind the scenes, trying to track the different strains of COVID-19 and predict and better respond using the same core dashboard and reporting technology. Many of you may have seen this, but we're moving now from global level to the country level. Here's a story map of all the COVID dashboards for Central and South America. We move from the country to the state level, and here's a web map that highlights each state level's resources. And we go from the state to the county level, and these dashboards provide county level information. This is a pretty good dashboard here. This shows the risk in each county, looking at the 7-day county level spread and underlying risk model, undersupply risk model. And as we saw from Racine, there's very valuable apps that deliver real actionable information at the local level. What's closed, where to get food. There are many useful apps and information products that can be on this hub that we'll have a follow-up meetup on. Kim did an excellent job in describing the value of hubs to communicate. Here we have equitable property value, a hub specifically designed for assessors to engage the public, which contains valuable information, not just on property values and data, but the processes being used, calendars, and a feedback loop with taxpayers. These hubs are all software as a service and hosted in the cloud, so they're quickly deployed. Now, drilling down, you may have seen these infographics for COVID planning and response reporting. This contains information on age, poverty, those with disabilities, and a lot of population or demographic information. We can get a really quick picture of a county, but when we respond, we need to go to the next level down. This infographic is using assessment neighborhoods and data in your CAMA system to drill down to the neighborhood level. If you don't have neighborhoods, any area can be used to build these useful infographics at the neighborhood level. So hopefully you can see how the same technology used at the global level, the national, state, and county level, can be used at the local level, leveraging the data inside your CAMA system, along with if you have geographic locations like assessment neighborhoods in your CAMA system. Now I'm going to pass this over to Kevin. He's going to drill in a little deeper on how to do this. Again, we'll have a meetup on Friday, and we'll continue meetups as long as there's interest in this particular area. All right, Kevin.
So if you drill into the parcel data, we're linking this to CAMA. And in here I have my assessment neighborhood code. So what I did in preparation for the webinar is if I come over here and I turn these guys off and do it by neighborhood, now I have all my my city by neighborhood. So what I did was I created inside of, you can use this data inside of Community Analyst, which comes with our Premium Hub offering. Now there's a number of ways you can use the data. We do have out of the box that comes selected geographic areas. So if I come and I select from a map, we have predefined zip code level, county level, census tract, block groups, so on and so forth. But you can also take it to another level where I can take my my other data, I can add data, and I can go out to my web maps and layers, which goes out to my organization and my ArcGIS Online or your portal, and you can publish the data that you just did, that we saw back here that I did in Pro, publish those maps out to ArcGIS Online. Now I can use those defined areas inside of Community Analyst to do my analysis. So for instance, I can come over and I can come over to here, and I published out the City of Racine neighborhood map. I'm going to select that. And then I can filter down to my maps and layers and reports. Now, if I zoom into Racine, I see the same map that I publicized, and here's my neighborhoods. I have the same data published out that I can use. So now what I can do is I can come in here and I can select one of these neighborhoods. So it's doing a selection set now, and you'll see it'll get crosshatched and stuff when it finds it. And then I have my infographic. So inside of Community Analyst, we have templates. And the templates are designed to give you the information for that particular area. But as I said before, we have our predefined areas, but now you can come in and define your own. So these could be neighborhoods, they could be whatever areas you're interested in. If you're interested in commercial districts where there's high traffic volume, or police beats, or EMS, or however you want to do it. And then we have inside of Community Analyst, we have this coronavirus impact planning. So now what I'm going to do is I can take that report that Brent showed you and run it against the neighborhood that I selected. And it'll return to me the map with all the demographics for just that particular neighborhood. And again, this is all based off of your camera. So you're in the driver's seat here on how you want to depict this information. So if you want to go by zone, if you want to go by neighborhood, and then once you drill down to the neighborhood, you know, the assessment office has down to building details. So now you could filter your parcels to condos, hotels, gas stations, places that get multiple traffic in the same area that you may want to be focused on for whatever you're dealing with. And this could be for COVID-19, or it could be for something in disaster planning, or, you know, however you want to do it. I just wanted to indicate to you that there's ways you can use your assessment data inside of Community Analyst or Business Analyst to drive these reports based on your defined areas from CAMA. And with that, I'll break it off and send it back to Brent.
All right, thanks a lot, Kevin. Again, I pasted in the chat window. We'll get into the details and how to do this and take really specific technical questions on Friday. But we do have a couple of questions.
On that, can I just jump on that quick, Brent?
Yeah, sure.
So one real quick thing on that is, so on Friday, I'm going to show you how to take the data, bring it into Pro, run the process, publish it out to your ArcGIS Online account, wrap a web map around it, and then use it inside of Community Analyst. So the steps I went through, I'll break them down. All right, thanks, Brent.
All right, no problem. And if you don't have the resources or the technology, in the COVID hub that I pasted in the window, there is you can request resources if you need them. Free, of course. There's a question here for Kim and Kyle. Can you expand on the QC process for crowdsourcing the data? How you crowdsource a process for food resources?
Sure, so this is Kyle. So regarding the applications in the solutions themselves, that information is being submitted from anyone from the general public, but it is not immediately visible in the public mapping applications until someone from the county staff can receive the piece of information. And then the public is also submitting contact information, so the county has some sort of contact set that they can verify that location and then verify it. And Kim, if you wanted to touch on your internal process, by all means.
So just to give you an idea, the initial data was being kind of coordinated on multiple sources. You were seeing it from the local business groups that were in social media. People were all talking about, hey, we're still open. You know, we've got these hours now, and it was coming from everywhere. So we were trying to get all that information and put it on the map that we knew it was coming from that business directly, that we could say that, yes, this is an accurate statement. And so we initially put a bunch of stuff on the applications ourselves that wasn't crowdsourced, so to speak. But any new reports come in, then it just goes to a page that we review. And honestly, it hasn't had a ton of traffic. Right, so I don't have like a great like story on that, but I would say for the most part, we try to be proactive and get as much information on it ourselves, but allowing you to change or add things by doing the crowdsource functionality. Does that answer your question?
I think it sounded pretty good. Hopefully that answers the question. Kim, do you want to talk a little bit too about some of the things that you're thinking about moving ahead with? One of the challenges, and I think Kim can better explain this than me, or one of the ways she wanted to use some of her data is to figure out where there were apartment buildings or condominium sites with a single entry with multiple people hitting the same doorknobs and those types of things.
Right. So obviously we look at demographics, we look at age, if there is a health risk. Those are the obvious everyone's talking about, but they're also, we're doing the shelter in place. We're staying home if we can. So if your home is still a high traffic area because you all share a same entranceway, or you all share the laundry facilities, that's still potentially a higher risk than someone who is in a single family home and the only people they're in contact with are who live in that residence if they don't leave. So I wanted to kind of look at that and see where do we have potential higher risk. Doesn't necessarily mean that's is a higher risk, if people are cleaning those community touching places, but it just seems to me that could be a higher risk. So if we could use the community analyst to help identify those areas, then maybe this is an area we could educate better, I guess, or focus more on, and make sure that if it is an area that is potentially a hot spot, that we get in front of it. Not to say that we want to exclude other areas, but just trying to look at it from a different perspective. And I think that the community analyst and CAMA data definitely opens that door.
Yeah, and if I can interject, that's exactly the scenario that when I was brought in, and then we started looking at the CAMA data and use the neighborhood codes to break down, to identify some of those areas.
All right, we're just a little bit over time, and we did try to pack a lot in here, and hopefully it was valuable for everybody. I'd like to thank Amy, Este, Kim, Kyle, and Kevin for their time on this, and I'd like to thank all of you, all your time for attending. If you have any direct questions or anything you need right away, please email me, bjones@esri.com, and I'm happy to help direct you in the right direction. And in the chat window is the meetup for Friday. If you have additional questions, we'll get those questions in and get moving on that. And unanswered questions today, we will try to answer those during the meetup as well. And we will continue those meetups for some time, because from some of the responses we've gotten here, it looks like we've got a lot of questions to answer and a lot of resources to provide and help you out with. And with that, I'd also like to thank Oscar, who's behind the scenes pulling the strings that you don't get to see or hear. But thanks everybody, and have a good rest of the week.